Welcome to Geological Shoptalk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shoptalk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shoptalk is brought to you by LASA OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from LASA to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast.
Hello, my name is Anthony Vandermull, and I'm a licensed acupuncturist. And in today's Shop Talk, I'd like to offer some critical safety advice regarding needling gallbladder 21 and the upper trapezius region generally that you may not have heard before. My advice comes from having served as an expert witness over the last 15 years on a half dozen cases in which well-intentioned and experienced acupuncturists who were trained according to the current standards of the profession nonetheless caused pneumothorax injuries, and one of them was fatal. What's an expert witness? An expert witness is a neutral professional who reviews evidence and renders opinions in a court proceeding as to whether the acupuncturist's care was up to the standards of the profession, and if not, whether the substandard practice contributed to injuries, pain, and suffering. Reviewing these cases has caused me to go back to the clean needle technique manual and question some commonly taught, widely practiced, but now I believe unsafe techniques, and adapt them in my own practice, replacing them with safer needling angles and depths, as well as screening protocols and other strategies that are much better at preventing pneumothoraxes, and yet just as effective at achieving my clinical goals, if not more so. So unfortunately, it's not just dry needlers and MDs who cause pneumothoraxes, but they are avoidable. So the big picture here consists of 4 steps. Screen for risk-elevating presentations and adapt your treatment accordingly. Second, provide informed consent to your patients about pneumothoraxes prior to treatment, including educating them about the signs and symptoms so that they recognize the pneumothorax if it occurs. Third, specific techniques when needling gallbladder 21 and the upper trapezius region generally, most of which you can actually apply to anywhere over the thoracic cavity. And fourth, the critical step of managing, if despite all your efforts you do cause a pneumothorax accidentally, of managing it appropriately so that there's no progression to things like lung infections, permanent loss of lung volume, at worst case scenario, death. Okay? So let's go into these one at a time in a little more detail. Screening. This is what I learned from going back to the Clean Needle Technique Manual, 7th edition, which is available as a free download, easy to find on the web. First of all, here's the mnemonic I developed to help me remember this. So it needs to be in our intake forms, but also in our verbal intake, because patients don't always report accurately and everything on a written intake form. So we should always screen verbally for these things. Here's my mnemonic. Always review history and symptoms before rendering care. So the first letters there stand for ARHSBRC, which stands for A for age, progressive past middle age. The older the patient, the higher the risk. R stands for respiratory disease, COPD, emphysema, tuberculosis, cystic fibrosis, sarcoidosis, lung cancer, asthma. Any chronic respiratory disease elevates the risk of pneumothorax. H stands for history of spontaneous pneumothorax. I once had a patient tell me on my intake that they'd had 5 previous pneumos. So I had to tell the patient, we're not needling anywhere over your thoracic cavity. The risk is too great. S stands for smoking. Smoking any substance increases the risk of pneumothorax. And what smoking and respiratory disease have in common is that both of them can produce anomalous protrusions of lung tissue outside the rib cage. And I learned this the hard way when treating in my first few years of practice. I had an older male smoker who came in for treatment. I was doing some needling along the Watto-Jaji line using about a 1.5-inch needle, but needling in what I thought would be a safe angle towards the spine, sort of towards the tailbone and spine. Came back the next week, said, I had this funny thing happen where since I saw you last, when I coughed, laughed, sneezed, talked, I felt this pain in my upper back, and I called my doctor about it, and he didn't know what to make of it, and it just went away on its own, but I just thought I should report it to you. And I said, well, are you doing okay now? And he's like, yeah, I'm fine. And, he didn't seem to have any respiratory distress, no other signs or symptoms. So I avoided treating that region from that point forward on him. And I called up a doctor friend of mine immediately after that visit was over. And I said, hey, Dave, what was that, a pneumo? And he said, yeah, almost certainly you caused a small pneumo. You're just lucky that it spontaneously self-resolved. And I said, well, why? I mean, I thought I was needling in a safe angle and depth. And he's like, well, smokers, they can have these protrusions of very friable, delicate lung tissue outside the rib cage. Same thing with any chronic respiratory disease. Okay, lesson learned. Moving on. So B stands for body type. Tall, thin, muscle atrophy, little tissue over the thorax raises the risk for obvious reasons. R stands for rare. 3 conditions which I learned from the CNT manual, the first being Marfan syndrome, a genetic connective tissue disorder that makes for a tall, thin thoracic body. Think Abraham Lincoln, thin and gangly. Second, homocystinuria. Third, endometriosis. Endometriosis is not so rare, so we should definitely be screening for that. And then finally, C stands for corticosteroid use, either internal or topical, raises the risk of pneumothorax. So if you see these, the more of these risk factors present, the less you should be needling over the thoracic cavity and choose other strategies to achieve your clinical goals. Nonetheless, sometimes there's a patient who has, one of these risk factors or a couple of them, and they're in significant neck pain, and the upper trapezius is a very useful region to needle. So here are some safety considerations. This is very important in this region because apparently, according to CNT manual, 30% of pneumothorax injuries come from needling gallbladder 21, okay? But as it is very useful for treating neck pain, here are some safety considerations. Position the patient side lying so that the pleural cavity falls away from the needle tip. If I have a patient with right-sided neck pain, I put them lying on their left side, and then that gives me a couple extra centimeters of safety margin because the lung cavity is flexible and gravity will pull it down towards the table away from my needle tip. Second, when choosing a needle length, consider that retained needles can migrate inwards up to the handle. And CNT manual says don't use a needle anything longer than 20 millimeters over the thoracic cavity. I believe even more important than needle length, though, is needle angle. And the safest angles are transverse, just under the surface of the skin. The upper trapezius is a very superficial muscle just beneath the subcutaneous fascia. You don't need to needle deeply to have an effect on it. And also, if you look at a skeleton model, you'll see that medial to lateral and anterior to posterior are also much safer, and that's due to the flare and the angle of the ribs. Okay. Whatever you do, don't needle perpendicularly. And this is what I was taught and shown in the master's level training that I received, but it's very unsafe because the dome of the lung, the apex, the highest point of the lung is actually right under gallbladder 21, and a perpendicular angle, even with a short needle, runs a high risk of puncturing the lung. So I tell this to acupuncturists and say, well, how else do you draw the chi downwards? Well, what about kidney 1? What about liver 3? What about stomach 43? Those are some of my favorite points. Gallbladder 41, kidney 6, kidney 7. Look at your TCM text, have the patient meditate, and whatever. There's lots of ways to draw the chi down, but we don't want to cause pneumothoraxes by using a perpendicular angle at gallbladder 21. Next technique, number 4, is grasp the upper trapezius and pull it away from the underlying scapula and rib cage and lung. Okay. Some patients, the upper trap is just too tight to do this, but whenever possible, I like to grasp the fibers of the upper trap and pull it away from the lung cage, hold it between my fingers while I insert the needle, and that gives me an extra margin of safety. And then finally, whatever else you do, limit the depth of penetration of the needle to less than 15 millimeters, and don't penetrate into the region that is less than 3 finger widths superior to the clavicle. And, it really helps here to think, instead of 2-dimensional acupuncture points, we really need to be thinking in 3 dimensions about a living human body with its 3-dimensional tissue. And so to review those safety considerations, first of all, number 1 is avoid needling at all in patients with, elevated risk factors in this region, okay? But the other 5 safety considerations that I mentioned: position the patient side lying and needle the upside and let the gravity pull the lungs away towards the table. Second, choose a needle that is less than 20 millimeters in length, particularly if you do choose to needle perpendicularly. But third, don't needle perpendicularly. Choose a transverse, a very shallow insertion, angled medially to laterally or anterior to posteriorly. And then fourth, grasp fibers of the upper trapezius, pull it away before inserting your needle. And then fifth and last, limit your vertical depth of penetration to less than 15 millimeters and don't penetrate into the region 3 finger widths superior to the clavicle. Okay, so let's take a step backwards to informed consent. This is a crucial step prior to in your first needle insertion. We should always inform our patients about the risks of medical treatment, and that's not widely practiced or well taught in our profession, but nonetheless, it's the safest and best thing to do. So I always tell my patients right on the first visit where I'm needling over the thoracic region, there is a risk that the needle will puncture the lung. And I want you to know about this. Here's why, because if you develop any of the following signs or symptoms after acupuncture treatment, for that matter, after any an MD doing a cortisone injection, a vaccination, any procedure involving needles or a sharp object over the thoracic cavity, you should know that these signs and symptoms should not be dismissed. You should, in fact, call 911. So the most severe ones, the ones that really indicate an immediate 911 call are 3. Tachypnea, tachycardia, and cyanosis, elevated respiratory rate, elevated heart rate, and cyanosis, bluish discoloration of the skin and face. Okay, these indicate that the patient is running a severe oxygen deficit, going into organ failure, and that death is not far away. Okay, but any painful, difficult, reduced respiration, shortness of breath, these can all indicate a pneumothorax injury. And pain in the torso generally after needling over the torso, if it's worse on inhalation, sudden local pain or popping sensation when inserting the needle, new pain that wasn't present prior to needling, pain in locations where no needle was inserted, a dry hacking cough. Typically the pain is kind of sharp, pricking and stabbing, and it's also typically worse with coughing, laughing, sneezing, or talking. Okay. And then lightheadedness, incoordination, disorientation, malaise, fatigue. These can happen after any acupuncture treatment, treating anywhere in the body. But here's what's different about a pneumothorax is that these generalized malaise symptoms don't go away. They get worse with time. And they don't get better simply by lying down, drinking a little water, or having a snack. So clean needle technique manual advises us, and this is the standard for the profession, upon suspicion of a pneumothorax, we should immediately call 911. And that's because a delay in diagnosis and rendering emergency care elevates the risk of serious complications such as long-term loss of respiratory volume, lung infection, and death. So despite all these safety precautions, say you do unfortunately cause a pneumothorax. The final step, manage. Go into emergency management mode. And what's been a common feature of the cases that I've worked on as an expert witness is that the acupuncturists did the opposite. They went into denial mode, which resulted in a delay of care and complications that could have been avoided by simply treating the patient as you would treat your own spouse, your child, your parent, your best friend. Go, I'm sorry, this is a very serious situation, but we need to be over at the ER right away. You call 911 or they call 911. Somebody needs to call 911 and get that patient to the ER. Okay, so taking a step back, hopefully we don't reach that scenario because we've done these other things to be very careful. We have screened for risk elevating factors and adapted our presentation accordingly. We have done our informed consent and educated the patient about the signs and symptoms of a pneumothorax even before our first needle insertion. We've used our 5 safety techniques when needling gallbladder 21 or the upper trapezius region. And then finally, if God forbid we do cause a pneumothorax anyway, we manage appropriately. So if you'd like to learn more about all this, I invite you to go to my website at www.aomprofessional.com, where I have a distance learning class and also I teach a live class in safe needling practices for this important body region of the head, neck, and thorax. I also have an ebook on managing your risks of malpractice and avoiding malpractice, which I'm also by later this year, 2023, intending to turn into a series of short safety and ethics classes to get your NCC AOM PDAs. And then finally, I highly recommend spending a little time on a volunteer-run website called acupuncturesafety.net, where acupuncturists can anonymously upload reports of adverse injuries and accidents that come out of their acupuncture practice. It's a great learning resource, something we should all be learning from and also doing should you have an adverse reaction or incident. Even if you don't think you caused it, it's very instructive to read these reports. Okay? So thank you for your time and attention. I hope this keeps you and your patients safe.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. Lhasa OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit LhasaOMS.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at LhasaOMS.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.